So, on this World Asthma Day, let us reflect on the theme of this year. It is about making inhaler accessible to all. But inhaler accessibility is not only thing which we want. The reason is even those people who afford inhalers are not willing to take it. If we find out why, if I ask my patients why, there are many myths and barriers, or rather, it is a mindset. If the inhaler is going to help them, why people are so much against inhaler? So let us come to that level. The first and foremost myth is if I will use inhaler, I will become addicted to it. That is what the first question people will ask me. So, what I say to them is if you are using your eyeglasses, it is for making your life comfortable and not for making your life difficult. People don't say that you are addicted to your eyeglasses, right? The same way, inhaler are for making their life easy, to prevent the exacerbation, and to make them breathe freely. So the second myth is about if I will use inhaler, that means I'm more severe. I have the very bad disease, and those inhalers are only as a last resort. So to break that myth, I would say that inhalers are not last resort, but it is the first line of defense. Particularly the preventive one, the preventive inhaler which people use daily are for preventing their exacerbation, making their day to day life easy, and not allowing the exacerbation. So, to allow the control over life, they make them more strong rather than weak. The third myth, and mostly most of the people will be worried about what people will say, especially what I had seen is in last few years the asthma exacerbation or asthma rate has increased in adolescent girls and boys, and especially in our country where the girls marriage is main purpose or main reason the parents are worried about starting inhaler is if the girl is asthmatic or if they have to disclose that their daughter is using inhaler, will it go well with the in-laws? And that is very very valid point. So until and unless the overall society's mindset will change or the stigma against inhaler will change, the accessibility of inhaler is not going to work. So on this World Asthma Day, I would rather like to break those taboos, those stigmas, and those myths and barriers against inhaler. Let us make patient aware about inhalers are not addictive, inhaler are effective. Inhalers are not for making you weak, inhalers are for making you strong. And inhalers are not as last resort. It is the first line of defense and it is more effective because it is being delivered where it is needed most. I hope this message will help you for understanding inhalers better.